Welcome. Welcome to Science, Health and Healing Encyclopedia of Children's Health Code and Ali Academy. I'm Dr. Majid Ali. The subject of this video is when should you raise your insulin level? This video is part of a simply worded, simply presented trio of videos on insulin. Number one is entitled, when should you keep your insulin level as they are? Second, when should you lower your insulin levels? And this third one, when should you raise it? If you have type 2 diabetes and you have been taking different drugs, even if you've been taking insulin, you owe it to yourself to have a 3-hour insulin test done. Please have it done. Vast majority of the people who have type 2 diabetes in the first 5 to 10, sometimes 15 years are insulin toxic. They have too much insulin and yet they are being given drugs to further increase insulin activity. That pours fuel on the fires of insulin toxicity. Insulin toxicity, my term for insulin excess, is inflaming, it is fattening, it damages your heart, brain, kidneys, liver, muscles, every single part of the body. If you're insulin toxic, you're a young man, your testosterone is low. If you're insulin toxic, you are a woman, you're not menstruating properly. You're developing cysts in the ovaries. Now, sometimes I am surprised in less than 5% of the patients that when I test them with insulin and they have had type 2 diabetes for 5-10 years, they actually have lower insulin level. Of course, if you keep wasting insulin in type 2 diabetes, you will become insulin depleted. There will be no insulin left. So your insulin levels would be less than 2, less than 2, less than 2, and less than 2 in a 3-hour sample. Now I illustrate all of these examples of insulin conservation, insulin waste, insulin depletion in my book, Dr. Ali's Plan for Losing Diabetes. That book is available in a digitized form, instant download. Please go to majidali.com. If you order that book in print or digitized form, you will support our mission to provide free information, authentic information, free of deceptions. Now, if you are among that group of a few percent of the people with type 2 diabetes who even after 10 years are not insulin toxic, you are low insulin and your peak insulin value, let's say, is 80 and your blood sugar is 300. That's not unusual. But then you need to increase the insulin level. How do you do that? Follow Dr. Ali's Plan for Diabetes. Get a copy of this book. Read the plan 2 times, 3 times, 4 times. Can you regenerate your pancreas? Absolutely yes. I've given you examples on this encyclopedia. And there is an article, Pancreas Regeneration, video article, you can watch that. But please watch these 4 videos. 1, when should you keep your insulin as it is? When should you lower your insulin level? When should you raise your insulin level? And why should you have an insulin test done? Watch them 2 or 3 times. I absolutely assure you that if you do not understand insulin toxicity, you really do not understand the science of health, absence of health and disease, regardless of how much you've read. Now, some of clinical nutritionists may be offended by this statement, and endocrinologists, I don't particularly care for them. It is astonishing to me that I practice in New York, which is loaded with endocrinologists, university professors. I have yet to see a patient with diabetes who came to see me, having seen endocrinologist, who brought with him an insulin profile which tells me that the doctor is interested in insulin. No, they are all interested in glucose. Remember, as long as you're focused on glucose, you can never lose your diabetes. The only chance you can lose your diabetes if you are in the insulin depletion state is to create the conditions that pancreas can regenerate and produce enough insulin so you do not need any medications. All I can tell you is that it is possible. At this encyclopedia, my commitment to you is not to promise you results. My commitment to you is to be absolutely honest with you and do my best. Forward this YouTube segment to your contacts, friends, family. Support our vision of authentic information, free of cost for people all over the world. Thank you for joining me. Thank you so much.